Done and dusted, crashing with the Titans. We continue on with Morning at NTV's affairs, looking into the health sector, the pros and the cons, and what we get to pick out of the hurdles that we have jumped so far, one of them being COVID-19, the other being Ebola. My name is Priscilla Regina Naloga, and I hope that you're ready to take note of the opportunities in the health sector investment. Now, the health challenges in Africa underscore the importance of effectively investing in health systems. Unfortunately, there's no information on systems investments adequate for an effective functional health system. Now, just in Uganda, this sector, however, is fledged with opportunities for investment in improving the health system at a time when globally health crises are threatening. And we are going to be addressing this with Asewu Michael, who's the CEO, Link Medical Center. Good morning to you.
Good morning.
You're most welcome.
Thank you.
Okay. Just to kick-start off this conversation, we want to understand it in terms of information on systems investments and its adequacy for the kind of effective functional healthcare system that we want to see. It's a bit unclear where we stand right now, and COVID-19 as well as Ebola did a good job in showing us how unclear this is. From where you stand, could you give us clarity on health investments right now in Uganda? How are they faring?
Actually, in Uganda, health investment is one of the best investments I could advise those who are interested in it. Health investment is not only, does not need a person to go just like the way you're investing in anything. Health investment is you're investing in human life. You're covering the whole country, not only the whole country, the whole world. You're taking part of people's lives. So currently, according to the population of Uganda, Uganda is one of the third world countries, and we have a population of over 45 million Ugandans. But when you look at our health system, our health sector, one, is underfunded, and the population of Ugandans, compared to the number of public health facilities we have, the population is more than. The public health facility cannot accommodate the Ugandans population. That's where we came in and said, Ugandans are flying off to look for services outside. We have Ugandans who are able to invest into health sector. But how are we investing in? We came into investing into health sector when we looked at the dynamics of health. When you go to Mulago, you find the population of patients, the number of patients at Mulago lining up, waiting for one doctor. It's a little bit tricky. When you have a private health department, we come in to help government. In Uganda, less than 3%, 2-3% of Uganda's population have health insurance cards. The rest of the population goes to seek services to public government facilities, whereby it becomes hard for anybody around to wait for one doctor, yet you have emergency. So we came in and said, let's come in and be part of the Ugandans' health.
And what prompted you specifically to invest in the health sector?
What prompted me specifically to invest in the health sector is Uganda specifically is a virgin country that needs a lot in the health sector. And me as a person, when I was growing up, it was my ambition that at one point I need to have a hospital. That's why we came in to say, I came in and said and formed Link Medical Center. Link Medical Center, we are located in Mukono, and we are expanding to international health service.
Okay. Many Ugandans have complained that with the private sector investment, there's exorbitant prices that are, taken on by the patients or your clients per se, vis-a-vis what is charged or what government actually gives as subsidies. Now, in regards to the investment and you being direct participant in it, how are you enabling this extortion, to be dealt away with?
On the high prices, we have different clients we receive. The high prices, one is the country needs first to invest into manufacturing. Why the health sector goes...
Manufacturing of what in particular?
Most of the health equipments we do import. We are depending on imported products. So by the time you find the person has invested in a hospital, a fully fledged hospital, the price of the machines, you end up, that's why hospitals sometimes are charity.
You end up pushing that cost to the client.
You end up pushing the cost of the equipment to the client, and the client is the one to suffer. But when we have a manufacturing industry here, you find the cost of equipment are lower, and the cost of medications, acquiring medical service, is very low.
So, Michael, you're trying to tell us that we don't really pay more for getting the treatment or solutions to our health problems. We pay more for what you have invested in to come back to you.
You don't pay more on your health problem. But remember, when we are... A health department is like is a business. The cost of managing a facility like Link Medical Center, people want advanced health service. People want advanced health care. But you cannot come and give a person a service like someone comes, we have different kinds of medicines. We have Panadol at a cost of 500, but we have other Panadol at a cost of 1,000, 2,000. So at the end of the day, the prices is what determines somebody's health.
Okay. All right. In terms of health, the sector has actually been hit hard twice. COVID-19 came, Ebola, those are just the ones that have made noise. But we have even the underlyings like malaria that is killing hundreds of people on a daily basis. So in regards to just the two, COVID-19 and Ebola, what do you think have those two enabled the health sector to score on?
COVID-19, in fact, is one of the best opportunities for the health sector. The health sector has earned a lot in the COVID-19. One, government tried to make sure, at least in every region, the oxygen cylinders are provided. That was one of the best. And government tried to cut down the taxes, mostly on the taxable medical equipment like the cylinders. That came to a very good part in the medical department.
Okay. Away from that, back to health sector investment. What dynamics should one actually consider if they want to invest in this particular sector, and how does that improve in turn the kinds of services that we are receiving as Ugandans?
Whoever wants to invest into a health sector, one, you should not enter into health sector investment as a business that you want to profit you only. But when you're entering into health sector investment, enter into an investment knowing that you are entering into human life. The moment you make a mistake, you lose. And remember, health investment is one of the most expensive investment to start in.
Mm-hmm.
You might dash in and put in 200 million shillings, 300 million shillings, but when you don't provide the service that satisfies the community, that satisfies the public, definitely you will not manage. So health sector investment, first of all, begins from yourself, knowing that I'm investing on human life, I'm saving the community, I'm saving the country, and you are serving the world. Because you're not going only to give health care to either your community, you're giving up to international clients.
Mm-hmm.
That is how much we sell. That's how much we've come as a Link Medical Center. We are expanding to international standards.
Okay, all right. As you do the expansion, the reality of the matter is that there's still more challenges that are underlying in the health sector. And how are we going to be addressing those?
The challenges in the health sector currently is we have a problem, most especially when you come to government sector. The government sector is understaffed. That's one biggest problem. We have accommodation is one of the biggest challenges, more so in urban areas. The cost of living is too high, and that is one biggest problem that is bringing a challenge. Secondly, we have a problem of inadequate supply of medical equipments and drugs. That is one of the biggest problems that the country is facing. Because when you go to a public facility right now, you attend a doctor and you're written a sheet to go and find medication outside in the pharmacy, which is one of the biggest problems that most of Ugandans' health care is paid up for. But by the time you go to Mulago and you're expecting to receive, because Mulago is one of our national hospitals, you are expecting to get the best service from Mulago. But at the end of the day, you're going to Mulago, meet a doctor, you're expecting the best. At the end, you receive a sheet that go to the pharmacy and find this medication. That is one of the frustrating moments to patients and to the country at large.
Okay, all right. Mr. Asel, in your closing remarks in regards to the opportunities that are present in the health sector right now.
In the health sector, I would really advise, Uganda is still a very virgin country, and I'm calling mostly the youth to come in and invest in the health sector. And the government is really prioritizing technology and health sector to be one of the key aspects in the country. So I would love, we have youths who have the capacity to come in and invest, but maybe they lack capacity building to invest.
Okay.
That's why maybe I can also call government to come in and put in induction training to every parish so that people get to know educated on the health sector investment.
Okay. All right. Thank you so much, Mr. Asel Michael, who is the lead and an investor in health sector, that is Link Medical Center. And he has alluded, of course, to the capacity building and the understaffing that is grappling the health sector right now, the underfunding, as well as the growing population not being considered in terms of how much people are investing in the health sector. Tallying that with the population growth is equally important in us realizing a robust health sector here in Uganda. Now, this conversation marks the end of Morning at NTV, and again, pick yourself up a copy of the Daily Monitor this morning. You're going to be laughing and smiling and wondering and like, what? That's how intriguing it is. We're going to be calling it a morning for us here on behalf of Chris Higeni and myself, Priscilla, Regina Nologa, and of course the great team behind Morning at NTV. Adios, have yourselves a blessed day.